discriminate. It attacks everyone.
American to be prepared for the hard days that lie ahead.
Washington State reports the first coronavirus case in the United States.
This officially declaring a national emergency.
People start panic buying in stores.
Stay home, stay safe.
Quite simply, stay at home.
$2 trillion stimulus package that'll issue $1,200 checks to many Americans.
The physician I spoke with described this as a medical hurricane.
U.S. now surpassing 19 million cases of the coronavirus, adding more than 1 million new infections in less than a week.
The U.S. reported more than 100,000 daily cases for the last 10 days.
200,000 Americans dead from COVID-19. Each a life, each a tragedy.
Good evening and welcome back to COVID National News Update. I'm Eden Paget with my co-host Shannon Jeske. Unfortunately, COVID-19 death rates continue to climb here in the U.S.
We will discuss how the U.S. is combating COVID-19 with vaccinations and testing. We have a member of the CDC joining us later.
Our show tonight will feature a guest speaker covering the key points of the stimulus package and travel restrictions. We will touch on how some U.S. citizens are not confident in the vaccine and the information they may be receiving. Now to Elizabeth, highlighting misinformation and the public's response to COVID-19, live from the Capitol.
Thank you for that introduction, Eden. It's a beautiful day here at the Capitol building and people are enjoying the festivities. One of the vendors has agreed to speak to me today about her views and where she found the information that shaped those views. And information accessible today via the internet and social networking platforms can be largely hard to regulate. And the majority of people on social media that say they do not wear a face mask is because they do not believe that they work. And can you tell me, Destiny, why you've decided not to wear a face mask today?
Well, I do believe this whole plandemic is a lie. Plus, I have this face mask exemption card that was issued to me. It prevents businesses from forcing me to wear a face mask that violates my rights, and it could get me sick with CO2 intoxication. I saw this clip about it on Facebook.
This is false. Although the prolonged use of medical masks can be uncomfortable, it does not lead to CO2 intoxication nor oxygen deficiencies. Also, beginning of June of 2020, fake ID cards appeared for purchase online, often featuring logos or government insignias, and they claim that the holder is exempt from mask-wearing regulations due to a medical condition. And when Destiny refers to the term plandemic, she's referring to the 26-minute video that exploded on the social media site YouTube in May of 2020. And as quickly as the video sharing site can remove this video for COVID-19 misinformation, it's again reposted. Just one example of the difficulties social media sites face in regulating false information. Now, can you tell me, Destiny, if you've taken any other steps to protect yourself or your loved ones in the event that COVID-19 infection is in fact a possibility?
Well, I gargled with my daily COVID cocktail and had my bleach bath before coming here just in case. There was a blog about it online from this woman I follow. My own personal recipe is two parts bleach, 1 part rubbing alcohol, and even though, like I said, this virus is probably fake, anyway, my husband loves the smell, and I mix it with my bath water.
False. Conspiracy theorists, including those that center around the QAnon conspiracy, have advocated for drinking a diluted form of bleach called medical mineral solution, or MMS. These products are highly toxic and should never be used in an attempt to self-treat or prevent COVID-19 by swallowing, gargling with, or bathing in bleach or rubbing alcohol. I'm sorry, Destiny, are you okay?
I'm showing you that I don't have COVID. If you can hold your breath for at least 10 seconds, you don't have it. Didn't you know that? I saw it on Facebook. My sister, who lives in New York, shared it on our Facebook Mommies group. It was originally tweeted by someone that she follows.
False. This mythical coronavirus hold your breath test began circulating on Twitter, Facebook, and even via email in mid to late March of 2020, and it appears to have been written on an iPhone Notes app. Because COVID-19 is a virus that can cause respiratory tract infection, some people believe that this test is a good indicator of infection. In fact, it is not possible to tell if you're infected without an actual COVID-19 test administered by a healthcare professional. Now, thank you, Destiny, for discussing your views with us today, and I'd like to take a second to ask you about your booth that you have set up here at the festivities. Can you tell me more about it?
Thank you. For anyone still affected by the shortage, I'm selling rolls of toilet paper, $20 per roll, 10 roll limit. You can also find me online. My Etsy shop is www.etsy.com/tbloveforall, and I ship most anywhere.
Well, thank you again, Destiny. Shannon and Eden, back to you.
Thank you, Elizabeth, for that on-site coverage. And now, moving on to China, the country where the pandemic emerged on December 31st, 2019, according to the World Health Organization. The situation in China today contrasts what is currently happening in the U.S. China rolled out perhaps the most aggressive disease containment effort in history, according to a WHO report. Though not required, currently wearing masks is common practice in China. There's also mandatory testing for all Chinese and foreign travelers. The most dramatic and yet controversial measure was the lockdown of Wuhan and nearby cities, which put at least 50 million people under mandatory quarantine. China's economic response was quick as well, releasing the equivalent of $500 billion for boosting businesses, but not focused on households like here in the US. China also turned to technology, the most popular apps, Alipay and WeChat, to help enforce restrictions. Paraphrasing Jeremy Konendijk, a senior policy fellow at the Center for Global Development, China's use of social control and surveillance are not a good model for other countries, meaning no one else in the world can do what China just did.
While the U.S. is not mandating universal masking, Australia has instituted a mask mandate for the public. Australia's death toll stands at less than 1,000. Here in the U.S., we have exceeded 500,000. Australia's authorities have moved fast to clamp down on spread of the virus. Curfews have been imposed. Beaches, streets, and stores have emptied. Australians have been ordered to lock down at home. These measures have been implemented after 9 people have tested positive. COVID cases are single digits nationwide. When as little as 1 case is detected, the surrounding area is put into lockdown. An investigation is conducted and measures are taken for mitigation. Travel restrictions among different areas of Australia are put into place and lifted as COVID clusters are detected and resolved. There are COVID hotels used as isolation quarters. Australia closed its borders to all non-citizens in March. Any returning citizens must pay the equivalent of $2,110 US to spend 2 weeks in a state quarantine facility. Isolation and quarantine is strictly enforced by the government. Australia provides $1,500 Australian dollars every 2 weeks to workers through their employer. There are expanded benefits for the unemployed, disabled, retired, and welfare recipients, as well as one-time payments of $750 Australian dollars for individuals and aid to businesses and organizations as well. Please welcome our next guest live from the White House, Secretary of the President, Samantha Hill.
Good evening and thank you. Tonight I'm here to speak on COVID-19 travel restrictions and, of course, stimulus packages. As we know, on January 19th, 2020, the first case of the novel coronavirus in the U.S. was diagnosed in Washington state, disclosing that he had returned to Washington after visiting family in Wuhan, China. In February 2nd, 2020, the U.S. government temporarily suspended entry of foreign nationals who had traveled to China within 14 days prior, also regulating U.S. citizens, residents, and their immediate family members who had been in parts of mainland China. They were allowed to enter the U.S., but were subjected to health monitoring and possible quarantine for up to 14 days. Though, on January 3rd, U.S. airlines did suspend most U.S. to China flights. This also affected cruise lines. On April 9th, the CDC extended a no-sail order for cruise ships in the U.S.
On March 23rd, Washington State had their governor, Jay Inslee, impose a stay-home, stay-safe order. What was our U.S. government doing at this time to help these states boost their economies during the shutdown?
Thank you so much for asking, Eden. On March 27th, the first stimulus was released, offering financial aid to individuals, large corporations, small businesses, state and local governments, public health, and education. This stimulus also offered an additional $600 per week for up to 4 months to citizens filing for unemployment, as well as a $1,200 stimulus check to taxpayers.
And Secretary Hill, to go back to travel restrictions, what do these restrictions look like today?
Well, Eden, many of the travel restrictions put in place in March of 2020 are still in effect today. This includes the presidential proclamations on travel from Brazil and Europe. But as of January 28, 2021, U.S. citizens and legal permanent residents entering the U.S. are required to present a negative COVID-19 test taken within 3 calendar days of departure, or proof of recovery from the virus within the last 90 days.
And Secretary, what should U.S. citizens be looking forward to following the second stimulus approved December 27th, 2020?
As of December 27th, it was determined $286 billion would go towards direct aid. President Joe Biden is pushing to address immediate needs for the American people, currently working towards an additional $1,400 per person, for a total of $2,000. This plan will also include $25 billion in rental assistance.
Thank you so much, Secretary of the President Samantha Hill, for taking time out of your busy schedule to speak with our viewers about these important matters.
It has been my pleasure, Eden.
And now we have Daniela Bailey, spokesperson at the CDC, who is going to help us debunk some of the biggest myths about COVID-19. Thank you for being here today. So we've heard various claims about this virus, and the most common one is wearing a mask doesn't do anything.
Thanks so much for the invitation, Shannon. It's a pleasure to be here and educate the public. And the answer to your question is no, this is false. We have seen that in states that didn't have a mask mandate, once they put one in place over a period of time, the number of cases went down significantly. The data has shown that wearing a mask does prevent the spread of the virus. And although this is not 100% guaranteed, we know now that it reduces the chances of infecting others. Remember, the virus is spread by fluid droplets that we expel when we breathe, speak, sneeze, cough, etc.
Okay, that makes sense. Although there are still people who believe that. This is why we invited you to our show, so that you could clarify this. Here's another one. Asymptomatic people aren't contagious.
Asymptomatic people who feel and look perfectly well, are contagious to others, and we worry about them because they may not know that they are spreading the virus. In fact, during the early days is when you are most infectious. The reality is that we have to assume that anyone who could have it could pass it on to others, and this is why we're making recommendations that everybody should wear a mask and practice social distance, even if they're feeling well. It is also crucial that if you have any symptoms or have been in close contact with anyone who tested positive for COVID-19, that you go and get tested.
Okay. So how about contact tracing is a waste of resources? There's different opinions out there about this, and one is that contact tracing does not help stop the spread of the virus.
Contact tracing is the key strategy to prevent the further spread of COVID-19. Case investigation and contact tracing are core disease control measures that have been used by health departments for decades to slow or stop the spread of infectious diseases, and it is proven to be effective. CDC is providing guidance, technical assistance, and resources to help all states hire and train new and existing staff.
Okay. So maybe this is not exactly myth, but there is some uncertainty. Some people say that you cannot get sick twice with COVID-19. What are your thoughts?
We still don't know what long-term immunity looks like, and so in the immediate future, can you get infected with COVID-19 twice in a short period of time? The likelihood is no. Individuals that have been tested positive again for COVID-19 likely just have residual virus in their bodies, and this is one of those things that time will tell. The WHO website is a really good resource, as well as the CDC website at cdc.gov, to fact-check everything we hear, and those sites are being constantly updated as we learn more about the virus.
Okay. So there's groups who believe that we, the media, are blowing the pandemic out of proportion. Some think that all this is completely fake and that there is a secret agenda behind it. What do you have to say about that?
And I wish this were true, Shannon. And I think it depends a lot on which media you're listening to. There is misinformation. And let me tell the audience that social media is not a reliable source of information. By talking about conspiracy theories and to say that it's all a hoax, we are helping the virus. And the virus doesn't care. The reality is that COVID-19 is here, it's real, and it will infect given the opportunity.
Yes. Okay. So I must say that we at the Media Channel, our job is the commitment to report the facts to all residents of the United States. And well, here's another one. People are concerned with how quickly the vaccinations are developed and approved by the FDA. So another statement going around is that the COVID-19 vaccine will make me sick.
Well, we at the CDC validate those concerns, and we have to meet them with empathy and with science. None of the authorized and recommended COVID-19 vaccines contain the live virus, and this means that a COVID-19 vaccine cannot make you sick with the disease.
Okay. So last but not least, what can you tell us about what the government is doing in regards to the distribution of the COVID-19 vaccine?
Well, the federal government has been working hard since the pandemic began. Funds were immediately allocated to develop, manufacture, and distribute safe and effective COVID-19 vaccines. And vaccinations began on December 14, 2020. The National Guard is hands-on the distribution, making sure every resident gets a vaccine. And please, as vaccinations happen across the United States, it is very important that everyone continues to wear a mask, stay 6 feet apart, avoid crowds, and wash their hands.
Thank you, Dr. Bailey. Stay safe, stay well, stay in tune, and stay informed. And that's very important. Thanks also to our guests.
Thank you, Shannon.
Thank you for watching. Good night, America.